The mission of this fellowship is to allow the urologist to improve his or her skills for the management of nephrolithiasis, so kidney stones, and for the management of benign prostatic hyperplasia.
Our fellows will learn how to clinically be effective endourologists. One of the things that we really stress is learning tips and techniques for advanced endourologic procedures. But one of the interesting things about our program is that we're interested in research, and fellows will have the opportunity to choose whether they want to do clinical, basic science, or both types of research.
It's rare to have a true basic science lab in endourology. It's actually something that Dr. Scotland's known for, learning about funding, learning about setting up a lab as a junior attending, and investigating questions that haven't really been looked into in the basic science arena.
We're interested primarily in stones and stone pathogenesis in my basic science lab, and so really fellows have a chance to make every project their own.
You can go to any lab, and if you have any idea that you want to look into further, you have all the resources at your disposal.
Fellows have the opportunity to rotate between multiple hospitals at UCLA. They're going to be primarily based at our Santa Monica location, where a lot of advanced endourology will be performed. Then they also have this unique opportunity to be an attending at the county hospital here in Olive, and they get that opportunity to see a really diverse group of patients. So it gives us an opportunity really to give back and to learn how to take care of all types of patients.
As a public institution, we also have a very public mission to diversity, equity, and inclusiveness.
The endourology program is addressing the barrier of racial disparities in Los Angeles specifically, in access to care for stone management and benign prostatic hyperplasia. We're at least able to make some of a contribution for improving racial disparities for access to care. We have fantastic mentors here, and learning how they talk to patients, learning how they operate and manage various issues that we have some exposure to in residency, but in fellowship we really get to perfect those things.
What I hope the fellow gains is an opportunity to really stake a claim in endourology, to learn how to do everything that is offered, to have an opportunity to really see the new innovations that are being introduced in endourology. It's an exciting time, and we are hoping that the fellow will be able to experience all of the different new techniques that are coming into play, and will really have an opportunity to decide for him or herself what his future will be.
You really can mold this fellowship to be what you want it to be. It's important to identify what skills you want to perfect walking into this fellowship, and Dr. Dunn and Dr. Scotland will work together to give you the best learning experience possible to make this year really worthwhile.
You see yourself
healing the world. You see yourself here.
Here. UCLA Endourology.